What is pharmacotherapy? It is the art of treatment of disease and medical conditions through the administration of drugs. Pharmacotherapies can be used to reduce the intensity of withdrawal symptoms, to manage cravings, and to reduce the likelihood of a lapse or relapse by blocking a drug or addictive behavior's effect. An interrelationship between physician and pharmacologist for the clinical application of drugs in diseases. Proper selection of drug for a particular patient in an underlying disease.
What should be the criteria for proper selection? 1. Preferred or correct route of administration. 2. Accuracy or safety of the dose. 3. Knowledge about the adverse and toxic effects. 4. How it will produce its effects in body after administration. 5. How absorption, distribution, metabolism and excretion occurs after administration. Benefits of pharmacotherapy. 1. Effective. Quickly relieve symptoms like pain, inflammation, anxiety, or high blood pressure. 2. Fast-acting. Drugs can control or even cure diseases and prevent complications. 3. Non-invasive. No surgery required. Taking medication is usually simpler and less physically demanding. 4. Improves quality of life, helps patients function better, especially in chronic conditions like hypertension or depression. 5. Accessible. Many drugs exist for the same condition, allowing personalized treatment options. 6. Flexible. Often used alongside lifestyle changes, psychotherapy, or surgery for better outcomes. Drawbacks of pharmacotherapy. 1. Side effects. Medications may cause mild to severe adverse effects, example nausea, dizziness, organ damage. 2. Drug interactions. Taking multiple medications can cause harmful or reduce effectiveness. Dependence risk. Some drugs, like opioids or sedatives, can lead to addiction or misuse. 3. Not always curative. Many treatments only manage symptoms rather than cure the underlying diseases, example chronic illnesses. 4. Costly. Long-term medication can be expensive. 5. Adherence issues. Patients may forget or choose not to take medications properly, reducing effectiveness. 6. Resistance. Overuse of certain drugs can lead to resistance, making infections harder to treat. Example: antibiotics.